study is the influence of multi-level transforaminal lumbar interbody fusion on spinopelvic parameters and the clinical outcome in lumbar degenerative disc diseases. Low back pain is associated with significant burden, whether considered in terms of societal cost or personal sufferings. This is the biggest contributor to the number of years that people live with a disability. In this 21st century, this is not only restricted to the aging population, but there's a high prevalence of 57% in young adults less than 50 years of age. This sagittal imbalance cascade is a vicious cycle where the triggering factors increases the loading in flexed position associated with decreased bone density. It causes more compression on the anterior vertebral bodies, which is compensated by increased erector spinae muscle activity, which causes chronic fatigue back pain, loss of disc height, and arthritis of the posterior elements. This in turn leads to the loss of lumbar lordosis, which is compensated by pelvic retroversion, decreased thoracic kyphosis, as well as hip and knee flexion. As suggested by Dubosset, the spine and the body functions within the cone of equilibrium with the focus of maintaining the sagittal and the coronal alignment with minimal energy expenditure. Thus, the sagittal balance has a strong correlation with health-related quality of life in adult patients. In young adults with lumbar degenerative disc diseases, despite structured non-operative management comprising of neurotropic drugs, physiotherapy, ergonomics, or lifestyle modification, these medical treatments do not impact the patient's quality of life, and they progressively tend to worsen. So what's the goal of multi-level degenerative disc disease management in young adults? It's mainly to relieve their pain, either the radicular pain or the neurogenic claudication, and the axial back pain by doing stabilization and fusion of the degenerative segments and restoring the coronal and sagittal balance. So these are the well-known radiological goals of any fusion surgeries. Transforaminal lumbar interbody fusion is considered as the gold standard for lumbar degenerative disc diseases by restoring the lumbar lordosis as well as attaining adequate fusion. Minimal invasive surgeries have shown to decrease the morbidity by decreasing the intraoperative blood loss, postoperative pain, the narcotic usage, the length of stay, and earlier ambulation. Existing literature have reported good functional outcomes with 1 or 2 level TLIFs. With the anecdotal evidence of poor outcome, there is evident breadth in the clinical data of the positive of the effect of multi-level TLIFs procedure. So we hypothesize that multi-level TLIF procedure offers significant sagittal imbalance correction, fusion, and good clinical outcome in selected patients with multi-level degenerative disc diseases with low risk of perioperative and postoperative complications. This is the aim of our study. It was a retrospective study of 27 patients who were followed up for 2 years, where we measured the sagittal and coronal parameters in the follow-up radiographs, Bridwell grading of fusions, the VAS score, ODI, and short form 36 scoring. The mean age of our cohort was 42 years, where majority of the patients were in the obese category. Almost all our patients were operated through MIS, robotic navigated TLIF procedure, which showed relatively less operative time, less estimated blood loss, length of stay compared to the standard open TLIF, but the comparison group was a very small group. We achieved good restoration of the lumbar lordosis, the pelvic tilt, the disc height, and the sagittal vertical axis, which were statistically significant. Similarly, in the functional outcome, the VAS score, the ODI, and the SF36 score showed a significant improvement. At the last follow-up, we were able to achieve 96% of the fusion rate according to Bridwell's grading. This is the functional outcome scoring on various categories. This is one of our cases, elderly patient who had multi-level degenerative disc diseases, whom we operated with 4-level TLIF and showing good healing at 2 years follow-up. This was the amount of coronal correction we were able to achieve. This is another patient where the spino-pelvic parameters have been restored within the normal ranges. Here, the patient's sagittal vertical axis has been restored from 10 centimeters discrepancy to the postoperative 4 centimeters. Coming on to the discussion, there are hardly handful studies that have assessed the spinopelvic parameters and the clinical outcomes of multi-level TLIF procedures. And in our study, the short form 36 scoring had a significant improvement in all the scales except the role emotional scores. This is one of a paper where they studied 127 patients with multi-level degenerative disc diseases treated by MIS, minimal invasive TLIF procedure, either in the 1 segment, 2 segment, or 3 or higher levels, and they compared the outcomes depending upon the number of fusion levels. They concluded that regardless of the number of fused levels, satisfactory clinical and functional outcomes were obtained with MIS TLIF surgery, thus stating that this surgical procedure can be used even in patients with multi-level spinal stenosis. Another paper by Sanjeev et al., where he considered 360-degree fusion, where anterior as well as the posterior procedures or the posterior procedures only in 80 adults, and they assessed the functional outcomes, the complications, as well as the fusion rates. They concluded that in such extensive procedures, the goal of the surgery is to reduce and not eliminate the disability. Surgery for multi-level degenerative disc diseases in young adults is to regard in very long term. The main point is to restore the quality of life of the patients within the next coming 30 to 40 years. And in this, restoration of the sagittal balance has a very strong correlation with the health-related quality of life. In our center, the minimal invasive surgery, robotic guided navigation surgery has the advantage of less intraoperative radiation exposure when compared to other minimal invasive techniques. As in any adult degenerative surgeries, multi-level TLIF surgeries are documented to have high complication rate. In our study, we had 11% complication rate, where one case of post-operative foot drop was present, which recovered by the end of 6 months. 1 case of cage back out, which did not necessitate any revision surgery. This is a comprehensive chart of review of literature of other studies who have documented the multi-level fusion surgeries. Our study is unique, where we have taken into consideration of both the spinopelvic parameters and the functional outcome. The limitations where it's a retrospective study with a small sample size, short follow-up, and no comparative group. So finally, to conclude, multi-level TLIF procedures for lumbar degenerative disc diseases with proper patient selection and precise technique can provide significant improvement in the ODI by improving the sagittal and spinal pelvic balance. These were the references. Thank you.